International Overdose Awareness Day is August 31st, and communities across New Jersey are uniting in a display of remembrance, hope, and action against the opioid crisis. Last year, 97 people overdosed in Monmouth County alone, and 13 more lost their lives in the first quarter of this year. Led by excuse me, as I just lost my script, excuse me, led by Prevention Coalition of Monmouth County's um, opioid task force. The goal is to expand this into every municipality, and that is so important, especially if you know anybody who has had any kind of an addiction. You know how essential it is to have an organization you could turn to. And this organization turns grief into community strength. Joining us now is Dr. Tara Chalakani, who is Chief Executive Officer of Preferred Behavioral Health. Good morning to you, Dr. Chalakani. Good to have you on.
Good morning, Ken, and thank you for addressing this very important topic.
Well, I think everybody knows somebody who has had an addiction or currently has an addiction and what it does. And then maybe fortunately, it's a smaller number of people, but you know somebody or you know someone who knows somebody who's died from an addiction. And so it's impacted everyone. And that's why we can't just close our eyes and say, not going to happen to me. Everybody's touched by this. And that's why it's so essential, I think, that we all pay attention. What is Preferred Behavioral Health's role in supporting the county's overdose awareness campaign?
So, we serve the whole state in behavioral health and substance use treatment, and we have a lot of focus programs in 15 counties across the state. But one of our biggest initiatives is our Prevention First program in Monmouth County, which houses the Prevention Coalition of Monmouth County. And it is that mighty little group that is doing tremendous work, not only in preventing overdose, but educating communities, driving beautiful campaigns like finding parents who are hosting underage drinking parties, labeling at liquor stores, not selling to minors. So we're doing a lot of work with a small budget and a small team, but the work is really impactful. And what we're seeing
Mhm.
is numbers have steadily declined across the state of New Jersey in the last few years. Last year, we're looking at overdose deaths a little over 1,700. The year before, it was over 2,800. The year before that, it was over 3,000. So we're seeing clear proof that prevention works.
Yeah, doctor, I wanted to ask you about years ago. I'm 58, so years ago it was alcohol, alcohol,
Mhm,
alcohol, maybe a little bit of pot, right?
mhm.
Today, the marijuana that's out there, and we have legalized marijuana, not for kids, of course, but they get their hands on it, or edibles, etc. But legalized marijuana today is exponentially more powerful. And now we're finding more and more cases talking about deep depression, psychosis, all linked to marijuana and marijuana use. Are we finding that it's making its way to kids and impacting them more, even maybe more so than alcohol was, and how it might lead to other issues?
You're absolutely right, Ken. And the legalization of marijuana has really impeded our progress. And the accessibility of marijuana and marijuana products to minors is just unfathomable. Gummies are packaged to look really fun and colorful, and parents might be using them for sleep or anxiety or stress or what have you. So we're seeing a lot more of ingestion and medical incidents because of children getting their hands on these products. But you're right, a lot of these products are more potent. You know, in the 60s, marijuana was called grass for a reason because it pretty much was. But nowadays, it's very high potency. It's often laced with other substances. And obviously, you're no stranger to the importance of being aware of what fentanyl is doing to our communities. And over 80% of overdose deaths are linked to opioids that are laced with fentanyl. So we have a huge issue here. And New Jersey is making great strides because we're committed to fighting this battle, but the United States still remains the country in the world with the most overdose rates. I mean, that's scary.
And it comes down to money. It comes down to money. You have kids think they'll get a quick high, whatever, and it's going to be nothing. It's innocuous. I'll sleep and I'll wake up and I'll be fine. No, no. The thing, and for those that don't realize, as cheap as many opioids are, fentanyl's even cheaper. And
Right.
that's the thing. So it could be produced for pennies, and then they could sell it for whatever they sell it for, lacing those products. So you think, wow, this is good stuff, man. Meanwhile, you put that much too much. Or if you, as a young person, you weigh a little less, or you had some other substance that would impact, that would cross mix, of course, with the fentanyl. And I'm no doctor, forgive me, you are. You know how to speak to this better than me. But that's all it takes. Your central nervous system shuts down, you stop breathing, and your heart stops. There you go. So because
Sure.
of one night of fun, oh yeah, man, you're dead. That's it. Unless you have somebody right away who has Narcan, you're gone. So this is
For
why it's
sure.
so terrifying, and why it's so important. And thankfully, you're getting the message out. One beautiful thing, one of many beautiful things you do is you have the purple and white flags and what they symbolize. Talk about that, please, doctor.
So August 31st is International Overdose Awareness Day, but this is our overdose awareness month. So Prevention First, the Prevention Coalition of Monmouth County, our prevention programs at Preferred Behavioral Health Group have placed purple flags in 52 of the 54 municipalities in Monmouth County to represent the lives lost in the first quarter of the year. So as you're driving around, pay attention. And if you see the purple flags, each one represents a life lost. And we do this because we have to put awareness on the fact that communities, families, people are being impacted by the loss of their loved ones. And we have to understand that addiction is a disease, but it is preventable. So the more we can reduce stigma, the more we can have these conversations, and parents talk to their kids and educate them in schools and know what to avoid. And I want to educate you on something, Ken. Right now, one of the biggest issues we're seeing is gas stations and little convenience stores that sell a product called kratom and beverages that contain kava, which I see on my social media logarithms because I like to meditate and use organic products. So there's a lot of these drinks with kava in it, and children are getting sick and getting addicted to these substances. And they're legal, they're in convenience stores. So we really need to be aware of what's out there.
And people who don't realize, and thank you for bringing that up.
Mhm.
There was a story that I just read the other day of a woman who had a $3,000 a month, I believe, addiction to kratom. I wasn't sure it was kratom or kratom, but I've seen
Kratom.
it advertised ever kratom. I've seen it advertised everywhere, and I think everyone thinks of it as the healthy alternative. I have a friend of mine a couple of years ago who was recovering alcoholic, who
Mhm.
said, "Oh, this kratom, this is perfect for somebody who's getting off alcohol." And it right away, I thought, oh, just like people who were addicted years ago, who were, oh my God, what was the drug that everybody got? Who then they became addicted to the drug to get off of heroin.
Mhm.
I'm forgetting now, but I thought to myself, this doesn't sound, because if you have an addictive personality and if you're chemically addicted to one thing, the chances are very good that you're going to get addicted to the next thing. You just want to stop, just get off of it. It's not easy. That's why you need help to stop, but you
Yeah.
need to stop, and don't think that this is a healthier alternative. This is dangerous stuff, and you don't want to substitute one addiction for another. You had dozens of communities, as you mentioned, participating last year as well. What's the response been like this year, or outside of the county?
Well, I think overall people are becoming more aware and more willing to speak about it. I mean, I know myself, I see more on social media outlets and people are talking about overdose awareness. I mean, we do it for so many other illnesses. We have to do it for addiction as well because people are dying and we want to prevent this from happening. So what I would urge people to do is get educated, especially parents, be aware of what's out there, drinks that kids are drinking, check their backpacks, look for vape pens. A lot of youths are vaping marijuana products. So you want to be aware and get involved before this becomes a problem that can destroy a life. And I will say that at Preferred, we have free prevention programs. So if there's someone out there who doesn't know where to turn, please come to our website, preferredbehavioral.org. I'm accessible on social media. give me a direct message. If I can save a life, if my team can save a life, we're here to help New Jersey and abroad.
And as important as it is for adults who get chemically addicted, when somebody who is in their teens gets chemically addicted while their brain is still developing, it is that much more serious, right? I mean, you have developing brains who get hooked on marijuana, as you talk about vaping a marijuana product or on one of the drinks. It makes a difference, right, in a developing brain in their teen years as opposed to an adult.
It absolutely does. The earlier they start, the more likely they are to become addicted, and it does change your brain chemistry. You know, we're our brain is constantly receiving messages and responding to them. So if you're feeding it a psychotropic, mood and mind altering substance, it will change the development of a young brain. Absolutely correct.
100%. 100%. Just so important. Doctor, thank you for your message. Thank you for what you do. So important. International Overdose Awareness Day. It is August 31st. Dr. Chalakani, Chief Executive Officer of Preferred Behavioral Health. Thank you for coming on this morning and talking about this such an important topic. We appreciate you.
My pleasure. Thank you.
You bet.